assured me that she's going to follow up me regularly just to pick any abnormality. And this is a kind of a new medication where she's not expecting very serious side effect from it. She can reassure me more, like you've mentioned immediately, that we've got antidote for that. Even if you've got raised blood level from this medication, we can reverse this by something called antidote. Is it clear, Dr. Aqil?
Thank you, doctor.
Antidote from this, ma'am?
Is it one by one, guys? Let me check whether the doctor got the clarification for his question or not. And I'm going to answer all the questions, guys. Is it clear, Dr. Aqil?
Clear. Thank you, doctor. Clear.
Okay, thank you. Yes, doctor.
No, can we
Yes,
tell
Dr. Samsuna, yes.
in the advantage that no need for doing regular blood check?
Sorry?
Regular blood checkup, no need
No
medication in the
need.
advantage, like
No, for novel
need to tell,
anticoagulants, you are not going to monitor the blood thinning value. Or
yeah.
novel anticoagulant over the warfarin. So you don't need to tell her that we are going to check your blood thinning value, but you have to tell her that we are going to follow up you and keeping eye on you. We are going to just monitor you throughout your journey or throughout your illness.
No need to tell as an advantage also. This is
No, you don't have. So you've got a scenario which is a very clear scenario regarding new oral anticoagulant, regarding dabigatran by name. You don't have to tell her the difference between dabigatran and the warfarin. The only condition that you are going to compare dabigatran or novel anticoagulant with warfarin, it's going to be. So please, guys, mute your mics.
okay, Dr. Ala, I got it.
Okay, the only condition that you are going to, just give me a few seconds. Who's doing this? It didn't, the noise from where? I'm going to mute everyone, then please, Dr. Samsuna, unmute your. Okay, so the only condition where you would be able to compare warfarin to the novel anticoagulant, which is the scenario appeared in the last diet in Malta. Someone who presented with AF and the consultant decide the start of anticoagulant. No name has been mentioned. No category has been mentioned. So within the card, nothing called warfarin, nothing called novel anticoagulant. So you don't know whether the consultant needs to start warfarin or to start novel anticoagulant. So within your explanation, you are going to mention both. We've got two options, and you are going to mention the advantages and disadvantages of each option. Otherwise, you don't have to compare the medication with any other medications. Is it clear, Dr. Samsuna?
Yes, clear. Thank you.
Oh,
Doctor,
okay.
can I
Yes,
ask a question?
Dr. Sabah. Yes.
Yes, Dr. Allah. So, if she says I'm lactating, so we're gonna ask, do you plan to stop it or continue? Right? Am I supposed to ask this? And if she says yes, I plan to stop it, and if she doesn't, then we will have to. Then what should be my reply? How do I go?
What we are going to do? Are you pregnant by any chance? Do you plan for future pregnancy? Are you lactating for the time being? Those are my questions. Yes, doctor, I'm lactating. So let me tell you that this medication secreting throughout your breast milk. So it's better to stop lactation if you would be able to do so. Otherwise, I'm going to raise this issue to the management team and they will decide whether they are going to change another kind of treatment or not.
Okay.
Okay,
All right.
so this is your advice.
If she asks me, so is it unsafe during for my baby while I'm lactating?
Sure, yes, I'm told you that it's secreting throughout the milk.
Right. All right, Dr. Thank you so much.
Okay, so yes, we've got too many raised hands. Let's start one by one. Dr. Lama.
Good evening, Doctora. I want to ask regarding the past medical history. Asking about this will not affect the consultant decision?
No, it's not, because you are going just to stress on this point. Whether do you have any past medical history that I should be aware of, especially any kidney problem or liver problem? Just because you are going to offer help regarding this, and this medication would be adjusted regarding your liver function and kidney function test.
Okay. Thank you, Doctor.
You're welcome. Yes, Dr. Arshad.
Hello.
Hello? Yes.
What about travel history? Like, is she traveling more nowadays, or what about past medical and surgical history to look for a risk factor and to help her if it's reversible risk factor? Thanks.
Okay, this is the point, Dr. Arshad. Asking those questions going to be fatal for your scenario. So you are not allowed to ask her about whether she got any recent flight, any recent prolonged immobilization, any history of pregnancy loss, any history of oral sores or recurrent genital area sores. All of those things, searching upon the cause within your scenario, it's considered to be clinical history. You are not allowed to search for the thrombophilic risk factors in such scenario, because your patient already been diagnosed with a consultant. So the consultant diagnosed that, and the consultant decide the treatment, and the management plan, it's not going to be affected regarding the cause. And he know whether he's going to give her those kind of medication for 6 months, for 3 months, for life. He will decide that. Did you get that, Dr. Arshad?
Yes, I get it. But if a patient asks us about duration of therapy, then that depends on whether the factor is reversible or not. That's why I was asking it.
Sorry, if the patient asked what?
Duration of therapy.
Okay, you are not allowed to give any time in station 4. So doctor, when you are going to start this medication as early as possible, when I'm going to have the result of my complaint impulse as early as possible, when I'm going to have the body within post-mortem examination as early as possible. Well, doctor, for how long you are going to give me this renal replacement therapy? This is going to be decided by the management team. For how long, doctor, I'm going to receive this blood thinning medication? This is going to be decided by the management team. Did you get that, Dr. Arshad?
Yeah. So we are not supposed to test the duration.
No, you are not supposed to do so.
Okay, thank you.
Doctor,
you're welcome. Yes, one by one, Dr. Alam, we've got
Yes.
doctors who raised their hands since the beginning. I'm sorry.
Okay,
So,
okay.
Dr. Shireen. Dr. Shireen. Okay, so Dr. Intisar.
Yes, Dr. Assalamu alaikum.
Wa alaikum salam rahmatullah.
So, Dr. Ala, one question raised by Dr. Sami, that if
Yes.
if the patient asks about other options of anticoagulation, so Is it her right to know there is other option, but dabigatran has been chosen by the consultant in the best interest of her case? Or
Yeah.
I will not mention that there is another option if she keep asking about this.
Okay, so this is a brilliant question and a very tricky question. If she asked it, doctor, I don't want to use this medicine, I don't want to take this medicine, is there any other options? Well, Mrs. Martha, we've got too many options regarding the blood thinning medication, but this is the best option that decided by the management team, and you are going to get the maximum benefit from this treatment, not the other treatments.
Okay, good.
Okay.
Okay, very good. Thank you,
Is it
Dr.
clear?
Yes, very
Thank you.
good.
Thank
Yeah.
you, Dr. Intisar. Yes, Dr. Samsuna.
I have done my class. Thank you.
Okay, thank you. So it seems that your hand still raised. Dr.
Ma'am.
Asher, Dr. Samsuna. Yes, Dr. Shaheen.
Ma'am, can you please repeat